tell us about the changes we would expect in a woman's body from the ages of 20, 30, 40, 50. Now, hormonal changes is a big thing. Especially when you're going into the menopause years.
Right.
Okay. And some of us out there are quite frightened because we are not educated on what to expect and how to take care of ourselves. So let's have the doctor talk to us about changes to expect in your body from the time, let's say 30, because 20s, they are young,
Yes.
you know, and we're still taking care of them as kids.
Yes.
Let's start from 30, where you cannot get to shed the weight. Get to 40 and you notice your thyroid is acting up.
Right.
You notice coarse hair or hair loss,
Right.
loss of energy, loss of libido, and then painful sex and
Right.
all symptoms like that. So I know this is your forte and I'm listening because I would like to learn a lot too from here.
Well, let me start at actually at the age of 20s.
Yes.
So 20s, I would say more than the changes in a body, which of course is one of the issues.
Yes.
The most important thing I would say is what are the concerns for a 20-year-old? In 20-year-old, I would say the whole 20s are divided into two groups, two important issues.
Yes.
One is contraception,
Yes.
and the other is STIs, or sexually transmitted infections.
Okay.
These are the two biggest concerns.
For the
And all the
20-year-olds,
changes
yes.
which occur at that time, then increased desire, increased libido, need to prove themselves, trying to become who they want to be. All these are big challenges for a 20-year-old kid
Yes.
when they face this world, and they want to be mature. They're kids, as you said,
Yes.
and yet they haven't reached the maturity to understand many things. Need to please people to become popular,
Yes.
and that becomes they do offer sexual favors, and if the man says, "Honey, I don't have any condoms," they still have sex, which is so crazy.
Oh dear. Yes.
And that's what I want to tell people. They don't do anybody any favors. Do favor to yourself.
Yes.
Be good to yourself.
Yes.
Be self-confident. Be who you want to be. You have the
No. Yes.
Okay, and say no. I'm not coming anywhere near you till you are protected. And also, amongst young people today, when I treat them, I often ask the question: do you ask the question from your partner whether they are either have HIV/AIDS or herpes or chlamydia or gonorrhea or HPV? And they do. And they do. A lot of educated people are asking that question.
But will they give an honest answer? You know, when it's heated up, people kind of, take absence of their senses.
You're absolutely right, and that's what leads me to the next important thing. This is called a universal precaution. Safe sex is a universal precaution. Like in medicine, we all have to gown and glove and use a visor at the time of surgery so we don't get splashed with body fluids.
Yes.
It's called a universal precaution.
Yeah.
Safe sex is a universal precaution, and you really need to do that all of the time.
Yes.
That means you don't, even if you ask the question, you're not going to trust the person. You're still not going to use protection.
Yes.
Oh, you say, okay, let's have sex. No. You got to have universal precaution.
Yes.
And that's very important
Okay.
to do.
Okay, that's for the 20-year-olds.
And contraception is another big thing for them, and we'll talk about that later if you
Yes.
want.
Yes.
In the 30, the biggest thing is fertility.
Fertility.
Yes, because at the age of 30, the fertility potential drops by 30%.
Okay.
At the age of 35, the fertility potential drops by 70%. At the age of 40, you don't want to know.
Okay.
So when people...
So 50 like us will just lay down and die.
You don't like, you will live other way. So I just want to stress to people, they feel young,
Yes.
and they are young. But the reproductive age group is very small.
Yeah.
It's from either 15 to 45.
Yeah.
But 30s is the best time that you should attempt to get pregnant and be ready to get pregnant. So, and look for pregnancies rather than, wasting your time thinking I'm still young, I can date, I can marry some other time.
Yeah.
If you're 35 and you haven't found a partner, I would even encourage people to freeze their eggs.
Freeze their
If
eggs.
the technology is available, you should freeze your eggs. And that's the most important thing.
Yes.
I would not absolutely would not tell anybody to, you know, while away the time, saying I'm still young, I can get married whenever I like. So it's very important that you stress to people that 30s is a time for conception and fertility consciousness.
Okay, so because the eggs you have after 30, I don't want to call them old eggs, but they're not as viable or as what? They have chromosomal deficiencies or?
Well, chromosomal abnormality occurs
after
as
30.
they age. They all get fractured chromosomes and all that stuff. But the more importantly, we are all born with about 400,000 eggs.
Okay.
And they start to reduce. The numbers start to reduce.
Okay.
There are tests available to test. It's called anti-Mullerian hormone. It tells you the fertility potential.
Yes.
R.M.S is actual test, blood test. We are doing more and more of that in recent times. But at the age of 40, yes, the chance of having a chromosomal anomaly when you get pregnant is 1 in 40.
Okay.
It's just, I'm eyeballing it. I'm not saying that's accurate.
Okay.
But at the age of 40, definitely chromosomal abnormality increases.
Okay.
So miscarriage increases.
Oh, yes.
Even if you do get pregnant, you can have more likelihood of miscarriage due to chromosomal abnormalities.
Okay. Okay, so now after menopause, all right, when menopause sets in, you stop having periods for, you're considered menopausal if you stop having periods for at least a period of 1 year. Okay. Now, it's a big relief to stop having periods for most of us. But then again, with that time comes some other discomfort that, you know, you need to be educated about and you need to learn to manage. What are some of the things we should look out for as we get into the menopause stage in our life?
Take 1 second to talk about the 40s.
Oh, 40s, we skipped. Okay,
so
yes.
The 40s is an age in which you have to be aware of beginning of cancers.
Beginning of cancers.
Reproductive cancers, yes.
Yes.
So one of the cancers most important and highest in the United States today, it affects 1 in 8 to 10 people, is breast cancer.
Breast cancer.
So the screening for breast cancer occurs age of 40.
Yes.
So mammograms, breast exams, breast self-exams. People don't want to touch their own breast. I mean, you have it 24/7, so why don't you just examine your own breast?
Yes.
People don't do that. When they do that, they are the ones who discover breast cancer first.
Okay.
And they come in and say, I felt a lump. Okay, this is the biggest thing which people come and say to me, Dr. Syed, I felt a lump. So 99% of the time it means nothing.
Okay.
But 1% it does, it becomes very important to examine your breast.
Yes.
That is taught to us at the age of, as soon as the first young lady comes to me, I teach them breast self-exam. It's downloadable, it's available on the internet, how to examine the breast. Breast examination.
Critical.
Breast self-examination, BSE. So you go to ACS, American Cancer Society, acs.org, and you can download the whole system of how to examine your breast. It's a definite technique. So when you're young, you start at the age of, as soon as you menstruate, post-menstrual, start examining.
Because you might feel lumps in the breast.
Get familiar with your own breast.
Yes.
If you feel anything abnormal, go to your practitioner and let them examine you.
Yes.
And they'll be able to tell you, oh no, reassure you, that's normal. Or yes, there's something, let's do a test. So test, one of the most important tests is mammogram. That in the United States starts at the age of 40.
Yes.
Unless and until you have family history of breast cancer.
Yes. And
if you have family history of breast cancer, it can start 10 years earlier than the person, first degree relative who had breast cancer. Say, unfortunately, your mother has breast cancer at the age of 40, the young lady, her daughter, should start at the age of 30 to have a mammogram.
Okay. Fibrocystic breast tissue.
Yes.
Sometimes you feel your breasts are heavy and
lumpy.
Lumpy. Yes.
Fibrocystic breast disease has absolutely no danger of getting into cancer.
Okay.
Only thing it does is it actually can prevent proper breast examination or alarm people that there is something when there's nothing. But I'd rather people be alarmed and come to a practitioner
than miss something. Yes. Okay. Oh, wow. All right. Now we know. 50s.
Yes.
And changes in the body. Menopausal changes in the body.
That's right.
What are the most important things to watch out for?
Yes. 50s, I call it the important area where you want to stay healthy.
Yes.
So you have to make those moves
Yes.
to stay healthy
Yes.
for the next 30 to 40 years of your life.
Yes.
The expectation of life is increasing, as you know, Regina.
Mm-hmm.
Now, in women, even till today, they say 85, but it's probably going to be higher.
Mm-hmm.
And God bless all those people who have made it beyond 85
Yes.
and doing well.
Yes.
The most important thing I would stress about 50s,
Yes.
apart from cancer,
Yeah.
ovarian cancer, uterine cancer,
Mm-hmm.
and of course breast cancer, which keeps on increasing as you live longer, is the biggest problem is osteoporosis. Osteoporosis.
Yes.
So osteoporosis is a condition where the bone is depleted of minerals,
Mm-hmm.
okay, calcium, and there are irreparable losses. It's not that you can reverse it. You cannot reverse it. If you have osteoporosis, it cannot be reversed.
Oh wow.
What we can do is to improve it
Yes.
by adding calcium to your diet,
Yeah.
adding vitamin D to your diet, because people say, oh, I'm always out in the sun.
Yes.
I don't think anybody's out in the sun that much. And you need to get vitamin D in your
Yes.
diet,
Hope you're
but it's not sufficient to get it from milk and yogurt and cheese. But you should get it from taking a mineral supplement, vitamin D supplement and calcium supplement. But and exercise.
Yeah.
Exercise increases the bone density by weight bearing,
Yeah.
and it adds structure to the bone, infrastructure. I just want a picture, if I can show that.
Yes.
Right there, that's right.
Yeah.
So this is a mineralized bone here.
Mineralized meaning.
Mineralized, yeah. That means it
Okay.
has a good bone structure, okay?
Yes. Yes.
It's but it's still in a postmenopausal patient. But when they
Yeah.
get into osteoporosis, it becomes completely empty. And they
Empty.
start.
Okay.
I just want to make sure it's not switched. Yes, it's switched.
Okay.
So
this one is mineralized because
no,
it's thicker.
this is mineralized after treatment.
Okay.
So one of
after
the treatment we have
treatment.
is injectable drug called Opodeo.
Yeah.
There's also Prolia injection,
Yeah.
which people can have.
Mm-hmm.
They're all newer drugs,
Yeah.
and they prevent osteo. This is a postmenopausal demineralized bone.
Yeah.
It is after treatment they build up with the bone structure.
Full of holes
Yeah.
and stuff.
So you
Yeah.
can see that difference between the two.
Yes.
This is the demineralized bone, and this is the bone which is being mineralized after treatment.
Yes.
So it is very important that people don't let yourself get into this situation. So how to do it?
Yeah.
Firstly, ask your mom, whether you are osteoporotic. So you make sure that your mother is, if the mother is osteoporotic,
Yes.
it's quite likely you will be too, because it's hereditary.
Yes.
So you are going to start looking after yourself from the age of at least before 30. At 30, you have all the mineral
Yeah.
that you have in your body.
Yes.
So children, when they're given milk
Yes.
and cheese when they're young,
Yes.
and yogurt, they are good. You know, Scandinavian countries, milk is available, and they all drink. So osteoporosis is very little in them. But in people like third world countries, where either diet is lacking or they're not drinking enough, Southeast Asian countries, they all have higher incidence of osteoporosis.
Osteoporosis. Do Africans have that?
No, they have far less.
Because of the sun.
Probably because of the sun, and just the bone structure is very
Bone
good, and they're
structure.
blessed
Okay.
with good bone structure.
But a lot of people wrote in talking about pain from their sacral area down to the leg, and the age group of that is like in their 50s.
Yes.
They're talking about spondylitis, sciatica, or cardia equina, or things like that. Is it a given that when you're in your 50s, especially in the African American community, that's going to happen?
Well, what happens is bone demineralization occurs, and there is a degenerative disc disease, and the discs collapse.
Yeah.
So if this disc is this big to begin with, it becomes very thin.
Yeah.
It's called disc desiccation,
Okay.
and it can be seen in a plain X-ray,
Yes.
but definitely in a MRI. So when that occurs, there is a narrowing of the foramina from which the sciatic nerve comes out.
Okay.
So sciatic nerve is the one which causes the butt pain and going down the leg or to the knee anteriorly and to the ankle.
Yes.
So that pain occurs because of compression. I'm not a neurologist.
Yeah.
But of course, I deal with a lot of women, and when they have sudden pain in the back, or there is no condition which is called kyphosis.
Okay.
This collapse occurs, and women have the Dowager's hump.
Okay.
They get all bent over,
Yes.
and this occurs because it's the curvature of the
Yes.
of the spine changes, and they become. You have images of older people carrying a stick and walking like this,
Yes.
and that's because of the humpback
Yes.
occurs
Yes.
as a result of bone loss in the spine
Okay.
and collapse of the spine.
Mm-hmm.
So sudden collapse of the spine causes not only disfiguration permanently, but also nerve compression, and it causes problems with the leg.
Okay. Also, another thing is the thyroid. Why is the thyroid such a major issue in women in this age group?
Well, thyroid is, let's say it's a common issue, but as you get older, there is anti-thyroid
Hormones in your system.
thyroid peroxidase and thyroglobulin antibodies occur.
Okay.
They get Hashimoto's disease.
Yeah.
Thyroiditis occurs, Hashimoto's thyroiditis,
Yeah.
and leads to hypo or underactive thyroid.
Yes.
Underactive thyroid, you start to become
Gain-
obese. Yes.
Yeah.
Obesity occurs, clouding of the mind.
Yes.
You get confused,
Yes.
memory loss, and skin becomes thick,
Yeah.
and there's hair loss.
Hell.
Hair loss and eyebrow loss, eyelashes loss. So your face changes and becomes myxoid. It's called myxoid, or like edematous.
Okay.
So that kind of facies occur.
Okay.
And in children it can occur if the woman is hypothyroid and she conceives a child with hypothyroid, and the child becomes a cretin
Okay.
and causes mental illness. Handicapped children are born.
Yeah.
But that's all changed because we are adding iodine to our salt.
Yes.
That's what major change occurred. So now the iodine is there, so people who, especially in third world countries, don't have that hypothyroidism as a result of iodine loss in the body.
Okay.
So now the most common reason for hypothyroidism is Hashimoto's disease,
Okay.
or antithyroid antibodies occur, and they attack, it's an autoimmune disorder.